Kukukwok's work actually touches on a wide variety of these domains, and especially medicine. So it's a really important part of our mission to support Mayan language maintenance and revitalization efforts wherever we can. So in part, this means producing bilingual educational materials, health materials like the one that's being passed around. And we also recognize that many native Kaqchikel speakers, if they're able to read, they're usually able to read Spanish and not necessarily Kaqchikel. There's a lot of research now in Guatemala showing that Mayan schools do not actually do much good and lasting language revitalization. True language revitalization has to be shored up outside of the classroom or else it fails. So education alone doesn't change the status of a language. But if you use that language in really important domains outside of the classroom, that could help. And you need a very diverse set of speakers in order to do grassroots language revitalization. So we've developed a method for how to use these neologisms and to use high-level Kaqchikel speech. Most of us believe that language revitalization doesn't have to happen for the sake of language revitalization alone. It doesn't have to happen in a vacuum. It can also be really helpful to the community in other ways. We have this perfect match between medical providers and people who care about language revitalization. We want to bring these people together. You know, the people that we work with, the communities where we work, they want medicine. They want medical knowledge. They care about this in a way that they don't necessarily care about language revitalization or linguistic revitalization as it happens in a vacuum. So medicine represents this true opportunity for multi-generational language transmission. Linguists were meant to partner with doctors, and we want to push other NGOs in that same direction. We've always aggressively encouraged organizations to do language revitalization work along with offering their services. And interestingly, we also want to push language revitalization people to offer services like health or water or things that people really need right now. Those things can go hand in hand. And if you're going to do one, think about doing the other too. And an interesting way to look at this problem is with kind of a near view, far view perspective. When we're talking with our native Kaqchikel speakers in the communities where we work, and they're talking about their priorities for their lives and their ideals for their community, speaking Kaqchikel comes out as a top priority. They care a great deal about speaking Kaqchikel, but it's not an immediate desire. It ends up sounding more like an ideal. When you're really sick, when you're poor, you want to not be sick anymore, you want to not be poor anymore. This is a thing that's very natural to feel. It's a near view priority. So it's a tough position to be in when you want your kids to speak Kaqchikel and you also want them to have a good job. We, those of us who are in the business of offering near view services, shouldn't be without far view ideals. We should not be without ideals. If we are, we're in danger of doing something demeaning or immoral. NGOs, as you know, are feeling a huge void in Guatemalan society. So we have governmental organizations that are completely unfunded. The medical and other domains are ones that the government has completely absented itself from. So the service organizations are filling in that gap. The governmental groups are, for whatever it's worth, contractually obligated to the peace accords. NGOs are not. Dimitrio Kaqchikel gave a talk at our conference in Guatemala a few weeks ago. He said, in the neoliberal era, English is as much of a threat to the Mayan languages as Spanish is. English is. In this post-peace era, it's our feeling that it may be the service organizations that are driving language death and not the government. NGOs are setting the agenda in Guatemala. They're setting the unspoken agenda, the real agenda. Our basic belief is people who care about services need to do language revitalization work also. And people who care about language revitalization need to offer services as well. We have to meet each other somewhere, so let's meet in the center. Thank you.